Good morning everybody, hope everybody's okay. Just a little video to tell you about a new service which is coming to Back to Fitness Physio. It is courtesy of a physio called Zoe Wood, who is a specialist respiratory physio. And just to give you a little bit of background, I first met Zoe about 16 years ago when I had just opened the business. And Zoe came to me as a newly qualified physio who at that time, the NHS, there weren't any jobs available for newly qualified physios. So rather than just sort of do nothing, Zoe contacted me and asked if she could do some shadowing, some work experience just to sort of keep a hand in. She then went off and got a job and has progressed through the ranks to become a really specialised and experienced respiratory physio. And it seems quite fitting that Zoe was there at the beginning of my business, that I can now be there full circle and be there at the beginning of her business, which is called Well Physio Ltd. So what we'll do, I will introduce you to her and then you can find out all about the services that are being offered. So welcome back to Zoe, who is here to talk to us about her new business, Well Physio Ltd. I think probably when it comes to physiotherapy, you tend to think about the sort of physio that I do, so musculoskeletal physio, maybe neuro and paediatrics, things like that. But as physios, we work in lots of different clinical areas. Zoe's been really busy, as you can imagine, over the past couple of years through the pandemic, so working on ICU. You'll have seen people like Zoe working in intensive care and on respiratory wards and things. So yeah, she'll tell you more about it. So big welcome to Zoe.
Thank you.
Tell us all about it then. So what's involved? What is Well Physio?
Basically, I've been working in respiratory care for many years now, and I absolutely love it. So I've gotten to the stage where I want to try and branch out. I want to try and provide some services that I can't do in the NHS. I might be able to bring it to people a little bit sooner, hopefully, than we can do normally. And more of a hands-on approach to treating patients rather than just a purely educational role.
Perfect. So I suppose the thing that people want to know is who's it aimed at? Who can benefit from it?
You'll find it's actually beneficial to a lot of people. There's quite a high percentage of people that have respiratory conditions in the UK. So any respiratory conditions like COPD, asthma, bronchiectasis, cystic fibrosis, fibrosis, and then not only alongside that, you'll find that there's a lot of neurological conditions like strokes, MND, some other muscular dystrophies. They all tend to come on with and progress into lots of swallowing issues, breathing issues, reduced strength of the muscles around your lungs and your cough, and we can help with those sorts of patients, whether it be providing equipment or different techniques that we can teach you to try and manage that patient. As well as that, we also get involved with, obviously, you might not have a respiratory condition, but you get recurrent chest infections, you have regular admissions to hospital, but you've not really been diagnosed with anything, but it's all breathing related. We can help with those. We can also help with people that have anxiety issues, because this can alter your breathing pattern, which gives you lots of different signs and symptoms. And also alongside the breathing pattern disorders, just severe breathlessness. So, people can have cardiac conditions that cause breathlessness as well as respiratory. So we can help with those as well. The other thing I'd like to try and do a little bit of, because it's an area that I really like, is helping people that have come out of hospital. And a lot of people at the minute are coming out quite deconditioned, and their independence has dropped quite a bit and they're more reliant on other people to help out with things. So one thing I would like to push is trying to get people's independence back up so that they can do things more functionally at home and not be as reliant onto the family.
So I suppose this is people that maybe they've not even been in hospital with a respiratory condition, but they've just been in for orthopedics, or they've had a period of stay in hospital where they've just been off their feet for a bit and getting the fitness back. And fair to say as well, different age groups, so it's not just your older people, is it, that can benefit? So I know for me, when my boys were little, if they got some sort of cough or you panic straight away, so you get to the GP, if you get to the GP, you just want somebody to help with that. So is it all ages that you'll cover?
Yeah, so in the time that I've been working, I have covered a range. The bulk of my work has mainly been with adults, but I have done on-call for paediatrics for 15 years. So I've treated both babies up to teenagers for that, so anyone could come.
Fantastic, that's great. So next thing I suppose is what would somebody expect when they come? So they think they've got a breathing problem, they've got asthma or they've been in hospital or something, they pick up the phone, book an appointment to come and see you, they walk through the door, what's the plan of action, what would they do, what would it involve?
So firstly, it's mainly a really long chat to find out more about you really. I try to tailor things specific to your issues, so the more I can find out about you, your condition, how you manage it, what your main issues are, I can tailor the treatment better for that purpose. The other thing that we will try and do is, obviously we will do an assessment, so as well as the chat about your condition, we will do an objective assessment. This involves me actually looking at your breathing pattern, where you're tending to breathe from, if you've got any secretions on your chest or any wheeze that may need medication or treatment. We'll also look at things like posture, muscle length, really get hands-on at trying to figure out what's causing the problems that you're having. We'll come up with a problem list that's obviously tailored to you specifically, and then the treatments will also be tailored towards that patient-centred problems.
Yeah.
After that point, we'll obviously do lots of education, manual techniques to try and help with lengthening muscles out, mobilising joints, mobilising secretions on your chest if you're really struggling to clear your chest. And then we will look at, obviously, following that up, so you'll go away, we'll come and review you after however long is appropriate, and then see how things are going and alter the treatment depending on how you're managing with it.
And I think that's the thing that people don't really get in the NHS, is the hands-on side of it. So obviously, like we were saying earlier, that when people with breathing difficulties can get really stiff in the neck, really tight in the joints, muscles really tight, those kind of things, because it's just harder to breathe in efficiently, isn't it? So I think that's a really good thing that you can offer, if you can kind of, help people with that and get things loosened off and, moving easier.
Definitely, it's a massive issue, and in majority of cases, at the minute, treatment is very much a case of, can we teach you how to do something, you go away and do it. It doesn't correct people's technique. A lot of things are phone assessments nowadays, and not even virtual, so you can't actually see the patient. And I think just actually being able to provide that hands-on approach and hands-on assessment for each person is a lot better.
I think it's reassuring as well. People want to see somebody, especially when it's something as emotive as breathing and struggling with breathing.
And it's something that often people don't want to admit as an issue. And it's one of them areas where actually, as soon as you start opening up about things, there can be lots of issues in the past and behaviours that can affect your breathing, and actually that breathing pattern can have quite a massive effect on other areas. Concentration and your function. Some people will be scared to do things just because it brings on their symptoms. We don't want that to happen. We want people to have a higher quality of life.
Perfect. So in terms of where, obviously we're sat here in the clinic, where can people access you? You're going to be here, I think, Fridays, is that the day?
Yeah, the main day will be Fridays. If I've got any other availability during the week, I'll try and do that as well. So there'll be some time here at the clinic. I will be offering virtual appointments, because I know there's an awful lot of people that still would rather stay at home and try and shield themselves from any risks, which is fine. We can also do it for people that live further away, or people that just want to be environmentally friendly and not, be using all that fuel to get anywhere. The other thing that I can do as well is there'll be limited availability for home visits, but we can do home visits for anyone that's housebound that needs that little bit of input just to get going.
Perfect. I think it's important to say as well that as healthcare, we're still, as it stands, governed by all the COVID regulations and mask wearing and all the precautions and things which are obviously going to be in place. So people shouldn't worry about that either, should they?
No, we'll be testing ourselves. I'm fully vaccinated, and we will be wearing the PPE that's recommended.
Yeah, super. So in terms of why people should come, we've sort of covered it. It's really, well, you summarise it. So why should somebody come and see you, Zoe?
Basically, if you've got a condition which you feel you can't manage yourself and you need some extra input, come and speak to me. I've got 15 years of experience working in the acute hospital trusts, working across both paediatrics and adults, and also between medical, surgery and intensive care. And at the minute, I'm also doing some community work as well, trying to prevent hospital admissions by teaching and educating end-stage COPD patients so they don't come into hospital. So I've got an awful lot of experience. I'd like to think that I've come across as friendly and have a really nice manner about myself, and people do tend to open up, and that's when you're going to get the most benefit. The other thing is I'll try and see you as soon as possible, because obviously the sooner you can be getting on with some of these things, the sooner you're going to reap the benefits, and you're going to be able to feel like things are improving rather than having to wait for weeks and weeks.
Perfect. And I suppose you'll be able to link in with people's GPs as well, won't you? So if you feel like medication needs reviewing or people aren't coping, you'll be able to recommend and communicate with a GP, which is good. So I think we've probably covered a bit of brief synopsis of what Zoe does and how fantastic she is. What I'll do at the end of this video, I'll pop the details on how you can get in touch with Zoe. And as we mentioned, it's going to be initially sort of Fridays that she's going to be here at the clinic, and then there's other things, home visits and things by appointment. So yeah, I think just have a think, see if it's applicable to you or to relatives, friends. I've even had patients who I've mentioned it to who have just had a chest infection that's just gone on for weeks and weeks and weeks, and they're just still struggling to clear it and to feel better. So anybody really like that, all ages. So yeah, we'll put the details on, and then you can get in touch, give her a shout and get feeling better soon. Thank you, Zoe, for coming down and talking.
Thank you very much. Thank you.